So hi there everyone, my name is Dr. Constance Wong. I am the dentist who is working with Andre Hedger at Excellence in Dentistry. So you've all liked Andre's Facebook page. And basically, if you've liked the page, it means that you'll be able to see my Facebook Live videos. We're doing these videos just to help answer a few questions that patients have raised whilst they've been in the practice. So kind of patients have asked me questions about things, and I've thought, well, actually, that's going to apply to everyone, not just to that one patient. So it's kind of a good way for patients to be able to ask questions, and then I can kind of relay the answer to everyone. So if you do have any questions in the future, then please comment on the page and I'll be able to answer them at a later date. Or if you haven't met me before, because I've been working here for coming up to a year now, if you haven't seen me before, just whenever you pop in, just give me a wave. I'll say hi back and introduce myself. So I was just going to do a quick few points on toothbrushing today, because as you know, our practice is really hot on oral hygiene, because obviously that's the basis of all your oral health. If you haven't got clean teeth, then it can lead to problems. So I thought, we have done emails in the past looking at toothbrushing. I'm not going to do any major, go into any major detail. I just thought I'd start with five main points that I think are important when it comes to toothbrushing. So number one, first step is to look in the mirror. So the more you can see, the more you actually know where you're brushing. I've actually had some patients, most people think, oh, you can just go by feel, when actually you do tend to miss quite a bit if you're not seeing what you're doing. It's kind of with anything, if you're drawing something or if you're doing something, you look up, you pay attention to what you're doing. That's the same with toothbrushing as well. The second point is to brush in a pattern. You have no idea how many patients I've seen who started brushing in one spot, then suddenly jumped to another spot, and then jumped to another spot. It's quite erratic, and so obviously if you don't have a pattern, you're more likely to miss spots. So I usually say, I've got a model, lovely model here. I usually say, oops, not everyone's teeth are quite that crooked. So I usually tell patients to bite together and brush the outside surfaces first, and then open, and then brush the inside surfaces. So most people are right-handed. Toothbrush here. I usually tell patients to brush on the top left first, come round the top teeth, then do the bottom teeth, the outside surfaces, then open and do from the top left, round the top, and then from the bottom, round the inside as well. When I say round the inside, I mean kind of where your tongue is, rather than the biting surfaces. Most people tend to find the biting surfaces quite easy to clean. It's more actually right on the inside and right on the top as well that people tend to miss. And that's actually where plaque tends to accumulate as well. So that's the second thing, brush in a pattern. The third point, sorry, I can't think of fingers. Third point, using an electric toothbrush. There is research to say that electric toothbrushes are better than normal toothbrushes. It doesn't say you can't do a good job with a manual toothbrush, but with a normal toothbrush, you have to do little brushes going around to clean your teeth. Whilst with an electric one, it does all the brushing for you. So literally you just hold it in the spot and it brushes, and you just hold it. So it's much easier. Some toothbrushes say that they brush 10,000 times, they rotate 10,000 times a minute. So there's no way you can brush that quickly with a normal toothbrush. What was the next thing I was going to say? Fourth point is, once you've finished brushing your teeth, spit out the toothpaste and don't rinse. The reason you don't do that is because you've got this fluoride in the toothpaste, and that's got lots of benefits to it to protect your teeth from decay. So if you rinse out the toothpaste, it's going to rinse away the fluoride and rinse away the benefits from the toothpaste. So, and the last thing I was going to say, fifth point, is to use something in between your teeth to clean your teeth. So that's whether that's floss, interdental brushes, toothpicks, something. It's a bit like when you have a shower, you'll wash your head from top to toe and hopefully kind of get behind your ears, go between your toes, under your armpits, and you kind of wash the whole of your body. With a tooth, it's not just the top and the sides that you need to clean. You actually need to clean in between as well. So what I mean by that, you kind of clean that side and the inside, and you can get the bits in between as well. In our practice, we do recommend flossing and TPing. If you don't do either of those, at least just pick one to start off with and then try and progress to doing more. I don't really want to bombard you too much. So just to summarize, 5 points that I said. Number 1 is to look in the mirror, see where you're going. Number 2 is to follow a pattern with your toothbrushing. Number 3, use an electric toothbrush. Number 4, spit out the toothpaste and don't rinse. And number 5 is to use TPs or use something in between the teeth to clear the plaque out there as well. Okay, so that is all I was going to say. If you have any comments or if you liked the video, please like it on the Facebook page. Comments, if there's any further questions you want me to answer, please write them in the comments and I will get to them at a future video. And yes, I think that's about it. So I hope you all have a great afternoon and I'll see you guys soon. So take care. Bye.